Welcome to the video, everyone, and welcome back, Gil.
Thank you, Stephen. It was good to be here with you.
Nice to have you. So let's start with the question, do I have to front load TRT?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
You don't have to know, and you shouldn't always want to anyway. This is something that is done seldomly, not too uncommon, but seldomly, and this is specifically done based on patient needs. When we have someone that comes in severely low, due to either recent suppression that was not mitigated properly and not restarted, someone who's had previous experience on TRT or androgens, whether it was on their own or through a provider, someone who's had previous levels where they know that they felt well, and for one reason or another, they have either crashed or they've come off or they've missed several doses due to running out of medication before a refill. Those guys are a little bit safer to kind of give them that little boost because you already know how they metabolize, how they respond to certain dosages, and what levels they tend to feel well at because you already have previous case studies with this specific patient. So it's a little less of a risk to get them to where they've previously been without kind of throwing them up there and hope that they feel well. When you get someone who's fresh and never been on any hormone therapy whatsoever, the idea of front loading or doubling down, if you will, on their initial dose does come with a potential risk for side effects that are more psychological or anxiety inducing than anything else. The risk of actually causing physiological damage from a hormone, especially at a moderately physiological dose, is very minimal to none. The risk of causing someone who's never had an injection or a hormone and is anticipating specific dose to feel ratio, for lack of a better term, and then telling them, look, I think you should be on 100 milligrams per week, etc. Here's where I expect you to land. And you know what, let's go ahead and front load you with 200 milligrams today. The psychological aspect for that patient, combined with the potential risk for anxiety or contrast between going from such a low state of androgens to such a spiked state of androgens, can cause severe anxiety. It can cause some side effects, which can include irritability. They can include some levels of insomnia, tachycardia, which is increased or rapid heart rate, possible increase in blood pressure. Now, while all of this is transient, this is very crucial when someone is starting a new treatment because the level of comfort and trust that you're going to build with this patient moving forward is going to take time, and it's going to take patience on the patient's end. And one of the things we always try to communicate is to give things an opportunity to work, not to promise results too soon, not to anticipate results too soon, but to give it a chance to work. I always tell guys, look, you have not woken up overnight and found yourself in a state of low T. The fact that you decided to test it now when the symptoms have gotten so bad does not mean that this is, last week you were at 1200 and today you're at 170. This is something that's been progressive. For you to want to get back to where you were is not going to happen in 4 weeks. Let's give it sufficient time because in the grand scheme, a lifetime of treatment is a long time. If we take an extra several weeks to find that sweet spot so we can hit pause and kind of coast in that nice zone for essentially as long as you're going to be treated for, I think that's a well worth investment rather than just try to shoot them up real quick at the risk of losing their confidence and causing some level of anxiety or some level of negative effects that is only going to not only put him back to where he started, but possibly in a worse mental condition. So I'm not a big fan of front loading. Again, there's a time and place for it. We have done it on occasion with several patients. We've had patients who've come in, they said, look, I was at 1300 for last year. I felt great. Ran out of meds. I was on vacation, didn't get my refill in. I've been off for 3 weeks now. Okay, I use 60 milligrams twice a week. Yeah, we may tell them, go ahead and take that 120 today and get back on your 60 in 3 or 4 days and back to where you were. But that's going to be a rare scenario. So I wouldn't tell someone who's necessarily low and is eager to get started sooner to go ahead and front load with the idea that this is going to hit me quicker and therefore make me feel better quicker, because you do run a risk of having the complete opposite effect. So hopefully that clears up a little bit of the why on why we tend to not want to do this too often.
Mm-hmm. Sure thing. And now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.